Hi, I'm Dr. Julie Marmon with ER Specialist Urgency Center, and let's talk a little bit about croup today. We're into croup season. It's the fall. It creeps up on us, and then all of a sudden cold, and suddenly they can't breathe, and it's terrifying. Most parents have been there. Many parents will experience croup. So what is it? It starts as a runny nose. It's usually clear runny nose, and then it'll progress to your kiddo coughing. We're talking little kids here, infant to 3 or 4 years old. At that point in time, kids tend to start growing out of it. But what happens is this cough progresses to a cough that we describe as a seal-like bark. And it's very distinctive. In fact, you could probably get on YouTube and look for croupy cough, and you would hear exactly what it sounds like. It's classic. We recognize it across the room, or even if you call your RN triage line, if you have that with your insurance company, they're going to hear it and recognize it. So what's the problem with croup? The problem isn't the cough. The problem is not the runny nose, nor is the problem the fever. The thing we really worry about is when your kiddo gets croup, they start to get a narrowed airway. And if you look, it's sort of right through here that your kid will start to narrow their airway, and that's what makes those funny sounds. That's when we start to run into respiratory trouble, because when that airway narrows, you can hear something called stridor. If you listen to your kid closely, they might be making a sound. It's a raspy sound when they inhale or exhale. Wheezing, and it's not a coughing sound. It's a sound completely related to breathing in and out, and that's called stridor. Stridor we don't like, especially if your kiddo's just hanging out on your lap, calm as can be, and making funny noises when they breathe in and out. That's when you should seek help. And there are several things we do if you need help. You come in, and you will likely get pretty rapid attention if your kiddo's looking like they're struggling to breathe, but we can fix it pretty quickly. We treat this with steroids, usually a single dose of dexamethasone, which is a steroid that has a fairly long, what we call a half-life, meaning it'll stay in the body for a while. We treat with that. We watch for a little while. We use humidified air. We can do that like we would through any other breathing treatment, but it's just air. We sometimes need to give oxygen. And if your kiddo's not improving with that humidified air, we sometimes will have to give an epinephrine nebulizer. So it's a breathing treatment with that epinephrine that will help really shrink that stuff right through here again that's causing the stridor and the breathing difficulties. So how do you know when to come and what can you do at home? Some kids just get like this every time they get a cold. Go in a bathroom, turn on the hot water, and make a steam room. That will help significantly. The other thing that helps is going outside into the cool night air. Fortunately, croup happens in the fall, so we've got cool night air. Take your kiddo, walk outside. Very often that will help significantly. It's not unusual to have horrible problems at home, and then you get to the hospital and your kiddo's feeling much better. That's not unusual. Sometimes you can get rid of it completely at home, and if you can, that's great. If the stridor resolves, if your kiddo's sleeping, no problem. Stay at home, let your kiddo get the rest they need to improve. So why don't we get it as adults? We grow out of it. We get the common cold, and our kiddos get croup. Every now and then, your child might need to be admitted to the hospital. That's a question that your physician who's treating you in the emergency room or at our urgency center can help you decide. But it's typically related to continued stridor, that funny breathing sound, or if the oxygen saturation won't stay high enough even while they're sleeping. Any questions, don't hesitate to call us at any time. We're always here to help you stay healthy. Have a great day.